Welcome back, everyone. This is our last week in the Math and Science of COVID. In our final week, we have a very special guest. Now, this is a recorded interview with Dr. Kendra Phelps. Dr. Phelps is a research scientist with the EcoHealth Alliance, and she was featured on Nat Geo's Virus Hunters. If you didn't check out if you haven't seen that video, I recommend that you check it out. It's really cool, and it's really neat to see somebody that we know. So, Dr. Phelps and I will discuss the intersection between wildlife and humans and how that intersection may impact our health. Let's get to it. So I want to welcome a very special guest, Dr. Kendra Phelps. She is a research scientist with EcoHealth Alliance, and she's also featured in the show Virus Hunters that's on Nat Geo. Welcome, Dr. Phelps.
Hi, nice to be here.
So a little self-disclosure, I have known Kendra for several years. We actually went to graduate school together, and she is kind enough to do this as a friend, and it's so cool to see you again and to have you back, and I really appreciate it.
It's nice to be back. I haven't been at Texas Tech or even virtually back at Texas Tech since I graduated in 2016. So it's nice to be back at my alma mater.
Welcome back virtually. Kendra is calling in or zooming in, I should say, from New York City. So she's actually not abroad at the moment, but and I hope she's going to tell us a little bit more about that. But yeah, so let's kind of get started. I am curious, and I think my students are curious about how you became interested in science and how you got started in all this.
Well, even as a kid, I was interested in animals. Huge animal lover, lived on a farm in Iowa. So I was surrounded by farm animals, and I was set on being a veterinarian. So when I decided to go to school, I first got a scholarship to attend a community college in Iowa, and I took advantage of that scholarship and spent the first 2 years working towards an associate's degree in biology, and then furthered that by attending Auburn University, where they had a vet school, but they also had a very active biology program. So I kind of left the option open to either go to vet school or go into biology. And I ended up graduating with a bachelor's degree in conservation research. But while I was there, I also worked at the vet school as a research technician. And so I got a lot of hands-on experience working with livestock. But I also knew that I still wanted to continue and pursue my education further, working with animals, but I veered more into wildlife research. And I started a master's degree at Oklahoma State University. And most of my work involves conservation. And while I was at Oklahoma State, I studied the impacts of what's called Superfund Sites. So these are large sites that are mined for typically lead or some type of heavy metal, but they also leave behind a lot of contamination, and the government really doesn't regulate what they do with that contamination. And so from that work, we realized that these large piles of contamination, what's called chat, that is left behind, leaches into the groundwater, and was having a negative impact on the rodent community. A few years later, they realized it was also having an effect on the human residents in the community, and ultimately bought everybody out and forced people to move out of the very large region that was part of the Superfund site. After that, I went on to work at a museum in Kansas, the Sternberg Museum of Natural History. And from that work, I learned a lot about the diversity of mammals. And in particular, I really developed a love for bats and bat research. So I began my PhD at Texas Tech University with Dr. Tega Kingston. And my research was looking at the impacts of human disturbance on cave roosting bats. So what kind of effect does it have on the population and community structure of bats when humans are hunting bats at those caves, collecting guano, tourism in caves, what kind of effect does that have on the overall structure of the populations, but also on the health of the individual animals. And from there, I then became interested in also what effect does that have on their immune system and their ability to fight off infections. And those infections sometimes are from pathogens that can be zoonotic in nature, and that means that they can be transmitted from an animal, in this case bats, into humans. And so that led me to my work at EcoHealth Alliance.
So that's a interesting and diverse background that you had, starting with the idea of going to vet school. But interestingly, it seems to have come around a little bit full circle to a degree. Tell us about where all this has taken you. I mean, obviously, you as we see in the show, you were in Turkey at the time, but where all, the research that you started when you were in your master's, and then moving into your PhD, and I guess since then, what cool places have you seen? What are the cool things that you've done?
Oh, wow. Well, some of the cool research that I've done has taken me, I focus purely on bats for research for at least the last 10 years, but I've been working on bats for 20 years. So following bats, I guess you would say, around the world, they're found on 6 different continents. And I've caught bats on every continent that they exist except for South America. And I still hope to go there. But for my PhD research, it was largely focused in the Philippines, but I did do some research in Malaysia. I'm also a founding member of the Southeast Asia Bat Conservation Research Unit that was developed and led by Dr. Tigga Kingston. And from that, we did training workshops on bat conservation and ecology in Vietnam, Thailand, Cambodia, Philippines, Malaysia, Indonesia. So I've covered a lot of Southeast Asia. For my current job, I travel to 7 different countries to collect data, and that ranges from Turkey, Georgia, Armenia, Azerbaijan, Jordan, Oman, Pakistan. So quite a large swath of area. But my first international research expedition was to Kenya, and that really changed my focus from working on North American bats to bats on a global scale.
So it's probably a better question to ask you where you haven't been instead of where you have been.
I haven't been to South America.
That's
the
fair.
furthest south I've gotten is Costa Rica, and unfortunately I haven't gotten further south than that, but I would love to work in Brazil, particularly because they have the highest diversity of bat species in the world. Over 200 species occur in Brazil, which is a significant number of species. But I just haven't gotten the opportunity yet.
Yeah, and that surprises me too, because we had so many colleagues as we were coming through graduate school that were from South America that you could have easily bummed a ride and gotten there and do something.
Yeah.
So tell us a little bit more about EcoHealth Alliance and what you do there.
So EcoHealth Alliance is a nonprofit organization. We're based in New York City, and we originated about 50 years ago. So we're kind of a young organization. We're pretty small. I think we have about 50 employees, but those employees range from veterinarians, social scientists, ecologists like myself. We also have data and analysts, and even people who study how pandemics affect the economy. Because our overall mission is to develop science-based solutions that prevent pandemics and promote conservation. So that, in other words, you could say we study how public health is connected with the health of wildlife species and the environment that we live in. And we take our findings and we develop interventions such as public policies or developing educational material so that we could prevent spillover events from happening. But also, we want to promote the conservation of wildlife species.
So that kind of, it sounds like you're kind of starting to talk a little bit about the One Health initiative. I know that CDC takes a lot of credit for the One Health initiative, but I believe One Health actually started with EcoHealth Alliance. Is that right? Can you tell us more about that?
Yeah, the term One Health, which really is a holistic approach of recognizing that our health is dependent on the relationship with that of animals and the environment. So you can't think of human health separately from those two other components. Animals, which could be wildlife, they can also be companion animals, such as dogs and cats, or livestock, and then the natural environment that we live in. And it's not always a natural environment. This can include urban environments as well. There are wildlife species and livestock kept in cities as well. But yeah, we take a One Health approach in everything we do, and that's because our vice president, Dr. Billy Koresh, coined the term One Health in 2003, and it's really taken off and is the basic foundation for really how much of the zoonotic disease research is conducted.
So I know a lot of what you do is disease surveillance, if that's the correct term. If not, please correct me. And if so, would you tell us more about disease surveillance?
Yeah, so disease surveillance is really when you're doing an ongoing systematic monitoring of, in the case if we're talking about zoonotic diseases, so those that can be transmitted from animals into humans, it's systematic monitoring of the occurrence, the prevalence, and the distribution of different potential zoonotic pathogens in wildlife species. So you're continuously sampling wildlife to see, are there any type of pathogens that could potentially infect humans? And also, what is the environmental context in which humans may come into contact with that animal and its pathogen? So this, for example, could be in with COVID-19, we've heard a lot about these wildlife animal markets where they're selling wildlife species for food. And so we want to monitor what kind of pathogens are even out there. First of all, we need to know what's out there. We need to catalog that diversity of pathogens, and we need to know, do they have the potential to infect humans? And if so, how can we prevent the two of those coming together, the animals and the humans coming together, so that transmission, or what we call spillover, where a pathogen jumps from one species into the other, we want to prevent that before it happens.
So it's really about taking a proactive approach as opposed to a reactive approach.
Exactly. And that's really where we're starting to see the field of disease ecology turn towards. Typically, it is reactive to a disease outbreak of some sort. Then we go in and try to figure out, where did it originate from? How is it being spread? What are those factors? And then we try to reverse the situation. What is that old saying? An ounce of prevention is worth a pound of cure.
Yeah.
And it has been shown even economically that if you can prevent, it's cheaper to do proactive prevention measures than it is to treat the problem after it's happened.
Yeah, to pick up the pieces as they've already fallen.
Yeah. So
Yeah.
that's where my work comes in. I'm involved and coordinate a regional project that does disease surveillance on bat species across Western Asia. So that's from Pakistan over to Oman, all the way up to Turkey. Our goal is, first of all, we're building a research network. So it's called WABINet, or the Western Asia Bat Research Network. We're trying to bring together a diverse expertise of virologists, public health experts, bat ecologists together to build a collaborative network so they can continue to build capacity to detect these pathogens in the region, as well as we have an ongoing disease surveillance project to monitor for, specifically, we're looking at coronaviruses, and we have been for about 3 years.
So not just SARS-CoV-2, but all the coronavirus species.
All coronaviruses, yes.
Yeah.
And there's a huge diversity of coronaviruses. And I think what people don't understand is, the news reports, when they're referring to COVID-19, they say coronavirus. Well, there's a lot of different coronaviruses. And in fact, there are 4 different coronaviruses that can contribute to the common cold. So humans have 4 different coronaviruses that cause mild symptoms in humans that I think account for about 10% of human cases of the cold. And then on top of that, we have now 3 coronaviruses that cause more severe disease in humans, one being SARS, so severe acute respiratory syndrome. That pandemic burnt out quite quickly, and maybe some of the people watching this won't even remember. It lasted from 2002 to 2003. There's also the Middle East respiratory syndrome called MERS. It was first documented in humans in 2012, but it still continues to have sporadic outbreaks in the Middle East. And then now we have SARS coronavirus 2, which causes COVID-19 and has reached pandemic level, which means it's spread globally. And will likely become the 4th endemic, I think will probably become the 4th endemic human coronavirus that we are going to have to continually deal with. I don't see that this is going to just go away in 2021, January 1st, 2021, or with a new administration. It's going to probably be something that we find measures that we can control it and live with it, but it's probably here to stay, would be my guess.
Yeah. Well, thank you for that. All of that was incredibly interesting, and I think very valuable for students to realize that, well, just as you said, coronavirus, that, there's a lot of coronaviruses, and it's not just this one. And we live with several of them, and this is going to be one that we're going to have to live with for a long time as well. So I think that's a really good point. I'm glad that you mentioned that. That's definitely something that we're talking about in our class. So now I want to take a little bit of a turn and give you an opportunity to get on your soapbox. If let's just say, how would you convince somebody from Dallas or Houston or some urban area that's far removed from places like China and Liberia and developing nations and things of that nature? How would you convince them of the impact of our encroachment? And I'll use the word encroachment. I think that that's appropriate here. Our encroachment on wildlife. And to put it another way, why should city dwellers care about topics such as climate change and deforestation and things of that nature?
Well, I think, just because you live in a city doesn't mean you live in a protective bubble. If anything, you probably have an international airport somewhere near you, and viruses, they've reached pandemic level because someone who is infected got on a plane and flew somewhere else. And the first thing that comes to mind is Ebola, the Ebola Zaire virus. It sporadically has devastating outbreaks in what the most recent one, well, not the most recent one, but the most severe one was in 2014 to 2016. There was a West Africa Ebola epidemic, which, okay, that's in Africa, but someone who was infected with Ebola got on a plane and flew to, I believe, Dallas or Houston, which you may remember this from 2014, went to the hospital with symptoms, infected 2 nurses. The patient ultimately died, but the nurses slowly recovered. So there's an example right there of what could have been something so much worse. If that person who was infected with Ebola came into contact with others before seeking treatment, they could have easily spread that to others. Did I just cut out?
No, I
Okay.
I still have you.
Sorry, some of
Yeah.
the symbols went away on my computer, and I thought maybe I cut out.
No, I think we still have you.
Okay.
The joys of Zoom.
Anyway, I'll continue on.
Yeah.
So another thing I like to point out to city dwellers is when we're talking about these live animal markets, we see and you'll see this in the episode of Virus Hunters, where it's the stereotypical version of those open markets where there's just blood and guts everywhere and all these exotic animals being sold. That is a prime place for spillover or transmission events to occur, because you have people coming into contact with bodily fluids from animals that are being butchered. But here in New York City, we also have 80 live animal markets. They don't sell quite as exotic animals. You're not going to find bats or python well, you might find python actually for sale at these markets, but you do find a lot of exotic birds, and avian influenza is a concern there. So I live in a city of 8 million people, and we have live animal markets, and all it would take is one person getting infected with a pathogen coming from an animal and then passing it to another human, and then that human passing it to another human. So we have to also think in terms of this pandemic that we're living through right now probably began with a single individual getting infected, and either prior to seeking treatment or while in the hospital, they infected other people who then went home and infected other people, and that's how it spread globally. So we always say that the next pandemic is just an international flight away, but honestly, it could just be a few blocks away from your home, because there are live animal markets. There is a potential contact there. And if you're a hunter, an issue in the United States with hunting, particularly deer, is chronic wasting disease. And while there hasn't been a human case of chronic wasting disease from consuming infected deer meat, it's obviously a concern, because you are required to have your hunted animals tested for the disease before you should consume the meat. So it's not a Africa problem, it's not an Asia problem, it's not a Chinese issue. It is the fact that we need to consider how we interact with animals. So that includes consumption. And that also not only just with wildlife, but if you think about how we produce livestock, they're in such high concentrations, particularly in Texas. When I lived in Lubbock, I remember if the wind shifted a certain way, you could smell Amarillo, because they have all those large cattle production farms. And when you have animals in such high density, you're gonna have transmission of pathogens between animals. And then those pathogens can be transmitted to the farmer. And the farmer can give it to his family or to the nurses or doctors they encounter at the hospital when they seek treatment. Because a lot of times you're not expecting these pathogens to be the causative agent of the symptoms. So you're not wearing the proper protection. And so it can spread very easily, even within a first world country.
So from an ecological perspective, how is our interaction with wildlife in rural areas or even developing nations? for whatever resource that we're interested in selling. uh, how is that interaction with wildlife contributing to all this?
Well, you have to consider that wildlife have evolved for thousands of years with these pathogens. So in the case of coronaviruses, many of those that have spilled over into humans, we believe originated in bats. But a bat can be infected with a coronavirus and not exhibit any symptoms at all. It's only when humans come into contact with the bats, maybe through hunting and consumption of bats, that, or they might have them in their house. That happens quite frequently, and that happens in the United States. I get a lot of calls from friends saying, I have a bat in my house. Typically, that is not something to be concerned with, but the bats are in your house because there's no more wild habitat for them to occupy. They would prefer to roost in a tree versus roost in your attic. But because we've pushed into their environments, we're pushing ourselves into having closer and closer contact with animals and the pathogens that they've evolved with. So while it might not make them sick, it's something novel or new to our immune system and can, as you can see from COVID-19, can have very severe symptoms and cause illness in humans. So we need wild spaces. We need to protect wildlife habitat so that we can coexist without contact. That's the key.
Yeah, and I remember from the episode of Virus Hunters where they were specifically talking about poaching, and these poachers would find their way into caves, and obviously not wearing any sort of PPE or protective equipment, and they are exposed to aerosolized urine, feces, saliva, even, et cetera. And so just that level of contact, they don't even have to be, everybody's worried about being bitten by a bat, right? But I mean, that's just breathing in some of those aerosolized particles could ultimately lead to these spillover events. Is that right?
Yeah, there's actually a documented case of, it's called Marburg virus. It's a kind of, if you want to say, a relative to Ebola virus. And the host for Marburg virus is a cave roosting bat. And they roost in colonies of thousands. And a particular cave is a tourist cave. And so there was a Dutch tourist who visited the cave. And if you think about it instinctually, when you look up, your mouth opens. And so you're kind of giving routes of exposure, if you will, through your eyes, through your nose, and with your mouth wide open. And that individual ended up inhaling some particulates of the Marburg virus, later went back home, exhibited symptoms, which of course in that, the tourist cave was in Africa and they went back to Europe. This is not a disease or a virus that occurs there. And so they misdiagnosed the patient and she ultimately died of Marburg infection. So yeah, you can be infected by something simple as aerosolized urine or feces. But typically, rabies is a classic example of a zoonotic disease. It also has a very wide range of hosts. So those animals that can be infected, any mammal can be infected, a horse, a deer, a cat. But 99.9% of rabies related deaths in humans result from domestic dogs that are unvaccinated. And so it doesn't always have to be in the wilds. It can be in the city as well. So kind of getting a little bit away from your question about air, it can be as simple as aerosolization. It can also be as simple as walking down the street and an infected, a rabid dog decides you're next, and that's all it takes, really. So it can happen in many different routes, but yeah, it can be simple as aerosolization of these particulates. And just the same as humans coughing on you, if they're infected with COVID-19, that's a route of transmission. So respiratory diseases are one of the more difficult to treat and stop the transmission route, because they can be aerosolized and they can stay in the air for short periods of time. So that's another concern.
Well, I want to thank you for taking some time. I know you are busy, and I really appreciate it. And I know my students appreciate you taking time to talk a little bit more about what you do, to tell us a little bit about some of your experiences, particularly what we saw in Virus Hunters. Again, Dr. Kendra Phelps, research scientist with EcoHealth Alliance. Thank you so much. Please be careful out there, be safe, and thank you for doing what you do.
Thank you. Thank you for having me. It's very fun to have a discussion about zoonotic diseases and how humans play a significant role in not only the current pandemic, but likely future pandemics, and how we can stop the cycle of crossover of pathogens from wildlife or animals into humans. So love to spread the message, and I really appreciate you inviting me to share that message.
Much thanks. You're the best. Really appreciate it, Kendra. Take care.
Thank you.